It happens on one specific day, not gradually, on one exact day. You pick up your phone, open a message, and suddenly realize the text is too small. You move your arm further away, slightly better, further still, better again. And in that moment, something shifts, not in your eyes, in your mind, because you understand it has begun. This isn't tiredness. It isn't bad lighting. It isn't time to change your phone. This is presbyopia, the age-related change in vision that comes for every single person on the planet. Absolutely everyone, regardless of whether you ever wore glasses before or not. And here's what matters. Most people find out too late. Not in the sense that they missed treatment, but in the sense that they lived with discomfort for years, not understanding what was happening. Changed phones, bought better lamps, blamed tiredness, when all they needed was to see a doctor. Today we'll cover everything: what presbyopia is, why it happens to everyone, how people live with it, and what can genuinely be done. To understand presbyopia, you need to understand one structure: the lens. It's the transparent natural lens inside the eye that changes shape depending on what you're looking at. Looking into the distance, the lens flattens. Looking up close, it becomes rounder and more convex. This happens automatically, without any conscious effort, thousands of times a day. This process is called accommodation. The lens works because of its elasticity. It's flexible, like young rubber. Tiny ciliary muscles surrounding it alternately pull and release it, changing its shape with every shift in gaze. But with age, the lens changes. It becomes denser, stiffer, loses its elasticity. Gradually, year by year, and at some point, usually after 40, it can no longer curve enough for close reading. The muscles try, but the lens no longer responds the way it used to. Focus on near objects stops being sharp. The brain receives a blurry image. A person instinctively moves text further away, because at greater distance, the eye doesn't need to bend the lens as much. This isn't solving the problem, it's compensating for it. And the comfortable reading distance grows a little further with each passing year. Presbyopia is the only visual condition that isn't a disease. It's a physiological process of aging. Like gray hair, like wrinkles. The lens ages in everyone, without exception. It doesn't depend on how much time you spend in front of screens. It doesn't depend on diet. It doesn't depend on whether you exercised or not. It doesn't depend on genetics. The only thing that varies is timing. For most people, the first signs appear between 40 and 45. For some, slightly earlier, for others, slightly later. But it comes to everyone. An interesting nuance: people with farsightedness notice presbyopia earlier, because their lens was already working under extra strain throughout their lives. And people with nearsightedness sometimes notice it later, because removing the glasses partially compensates for the difficulty reading. But this doesn't mean nearsighted people don't get presbyopia. Everyone does. Here is the typical picture of someone with early presbyopia. Morning, everything is fine. By evening, after a full working day, small text becomes harder to read. The smartphone needs to be held further away. In a restaurant with dim lighting, the menu is unreadable. In a well-lit place, manageable. Threading a needle has become awkward. Signing a document requires squinting. Labels on products are a mystery without enlarging them. After prolonged reading, a dull ache behind the eyes or a headache. Sometimes mild doubling that resolves after blinking or taking a break. If you already wear glasses for distance, they no longer help for reading. You take them off to read, and this too is a sign of presbyopia. And one more thing that catches many people off guard: presbyopia can develop even in those who had perfect vision their entire lives. For them, it's particularly startling. I never wore glasses, and suddenly this? Yes, suddenly. Because the process happens gradually, but the realization is abrupt. Presbyopia doesn't stop. It progresses slowly but steadily until around 60 to 65, until the lens has lost nearly all its flexibility. This means that reading glasses chosen today will likely need adjustment in a few years. Diopters will need updating. This is a normal process and nothing to fear. It simply requires regular revision. If a person already had nearsightedness or farsightedness, the situation becomes more complex. They now need different correction for different distances. For some, this means 2 pairs of glasses. For others, progressive lenses that correct vision at all distances simultaneously. For others still, contact lenses with different correction power in each eye. If I strain my eyes while reading, my vision will recover. No, straining doesn't train the lens. It only causes fatigue and headaches. The lens has lost its elasticity, and no exercise will restore it. If I start wearing glasses, I won't be able to read without them. This isn't true. Glasses don't worsen vision or create dependence. They simply allow the eyes to function without constant overexertion. Living without them with presbyopia is like walking on an injured leg without a cane. Possible, but why? There are exercises that help. Eye exercises can reduce fatigue, that's true, but they don't restore the elasticity of the lens. Presbyopia is a change in tissue structure, not a muscle problem. Laser correction will fix it. Laser correction works on the cornea and helps with nearsightedness, farsightedness, and astigmatism. With presbyopia, the issue is in the lens, not the cornea. Specific approaches exist, but this is a separate conversation with a doctor. The first and most accessible option, reading glasses. Simple plus lenses that supplement what the lens can no longer provide on its own. Easy to get, easy to use. The only limitation, they work at one distance only. Progressive lenses, a more modern solution. One pair of glasses corrects vision at all distances, far, intermediate, and near. The transition is smooth, with no visible boundary. An adjustment period is needed. The brain takes a few weeks to learn to use the different zones of the lens. Multifocal contact lenses work on the same principle for those who prefer to live without frames. Monovision, a method where one eye is corrected for distance and the other for near vision. The brain learns to use whichever eye is needed depending on the distance. Not suitable for everyone, but for many it's a comfortable option, available either as contact lenses or laser correction. Lens replacement. With high-degree presbyopia or in combination with early cataract, the natural lens can be replaced with a multifocal artificial one. This lens provides clear vision at different distances. It's a significant decision discussed individually with a doctor. If you notice that you're holding your phone or book further away than before, that's already a reason to come in. Don't wait until it becomes truly inconvenient. After 40, a routine examination once a year, even if nothing is bothering you. Presbyopia progresses, and timely adjustment of glasses is the difference between comfort and chronic strain. If you already have glasses, check when you last updated the prescription. If it's been more than 2 years, it's time to revisit. Presbyopia isn't a disease, it's life. It comes for everyone. The only difference is how a person lives with it. You can spend years squinting, holding your phone at arm's length, and tolerating headaches. Or you can come in, get the right correction, and forget the problem ever existed. Properly fitted glasses for presbyopia aren't a sign of getting old. They are a sign that a person values their comfort and quality of life. If you recognized yourself in what I described today, come in for an examination at Ko'z Nuri Clinic. We conduct a full diagnostic, determine the degree of presbyopia, and select the optimal correction method, specifically for your lifestyle and daily needs. After the examination, you leave with a clear understanding of your situation and a concrete plan. Contact details and booking are in the description below.